Welcome to The Explainer. If you're a nursing student, you know prenatal care is a massive topic, one that comes up all the time on exams and in your clinicals. So today, we're going to build the ultimate study guide, a complete blueprint that covers everything from that very first visit all the way to the final weeks. Okay, so let's break this down. At its heart, what are we really doing with prenatal care? It's all about making sure that the pregnancy and delivery are as safe as they can possibly be. The whole point is simple, but it's so critical. We want to reduce the risks for both mom and baby by catching any potential problems as early as we possibly can. Okay, stop and listen to this one. This right here, this is a huge flashing NCLEX tip. Burn this into your brain. When you're looking at those tricky scenario questions on the exam, if an answer choice pushes for early and consistent prenatal care, there's a really good chance that's your right answer. It is just that fundamental. So here's our game plan for today. We're going to walk through this just like you would in a real clinical setting. We'll start with gathering all that crucial information. Then we'll get into the visit schedule and all the tests. And we'll wrap it up with patient education, which is honestly one of the most important parts of your job. All right, so where do we even begin with all this? Well, it all starts with the foundation of everything we do in nursing, getting a really thorough history. Think of it like this. This is your number one tool for spotting potential risks before they even become big problems. First things first, you're putting on your detective hat for the medical deep dive. You're looking for clues, for patterns. Have they had pregnancies before? Any complications, like preterm labor? Do they have any chronic conditions we need to keep an eye on, like diabetes or hypertension? And of course, you're checking their immunity status and digging into family history for any genetic stuff that might pop up. Okay, next we zoom in on their daily life. And I mean everything. What's their nutrition like? Are they on any meds? And yeah, that includes over-the-counter stuff. And this is a big one. You have to ask about substance use. But you gotta do it in a way that's totally non-judgmental, right? Your goal is not to shame them. It's about keeping mom and baby safe. We're also looking for any hazards at work or home, and, so important, screening for abuse, because that risk can actually go up during pregnancy. And last but definitely not least, we're looking at their emotional well-being. How are they actually feeling about all this? Who's their support system? Do they have a partner, family, friends? See, this goes way beyond just collecting data. It's about opening up that conversation about their birth plan and figuring out what a good, positive experience really looks like to them. Okay, so once you've got that whole comprehensive history down, the rest of the pregnancy follows a pretty specific schedule. Let's take a look at what that timeline for visits and monitoring actually looks like. You can see a really clear pattern here, right? The visits start ramping up, they begin monthly, then shift to every 2 weeks, and bam, at the end, they're weekly right up until birth. And that makes perfect sense because that increasing frequency lines up exactly with the need for much closer monitoring as we get closer to the big day. Okay, another NCLEX alert. You absolutely need to know this schedule for your exams. This is super high-yield stuff. I can almost guarantee you are going to get a question that asks something like, your client is 32 weeks pregnant. When is her next appointment? You got to know this cold. So that very first visit is all about getting your starting point, your baseline. We're talking weight, vitals, all those first labs. But after that, every single follow-up visit is about one thing: monitoring for change. We're tracking weight gain, keeping an eye on blood pressure, listening to that sweet sound of the fetal heart rate, and measuring fundal height to make sure that baby is growing right on track. All right, now let's get into the nitty-gritty of the labs and the screenings. We'll look at what tests are done, but more importantly, and this is key for your exams, we're going to talk about when they happen. This chart lays it all out so perfectly by trimester. And there's a real logic to it, you know? The first trimester is all about getting baselines and screening for infectious diseases right away.
Then, the second trimester, that's our big window for screening for things like neural tube defects and gestational diabetes. And finally, the third trimester is all about prepping for a safe delivery, which is why we screen for things like GBS then.
And here is another classic exam trap. They will test you on the timing of these labs. It's not enough to know what a GBS culture is. You have to know it's done in the third trimester. I promise you, they love to throw a second trimester test into a first trimester question just to see if you're on your toes. We can do all the tests and collect all the data in the world, but it doesn't mean a thing without the most important piece of the puzzle, your partnership with the patient. This is where you, as the nurse, really shine. Your job as an educator is huge, teaching them self-care, helping them understand what's normal, and making crystal clear what the "call me right now" danger signs are. So these are the big health promotion topics you're going to talk about at pretty much every visit. Think of it as empowering them, right? We're giving them the tools to have a healthy pregnancy. That means talking about avoiding things like OTC meds and alcohol, staying active, and getting those super important vaccines, like the flu shot and Tdap, to protect not just them, but the baby too. Okay, this slide right here, teaching this difference might be one of the most important things you ever do as a nurse. It's about helping your patient understand the difference between "this is annoying but normal" and "this is a potential emergency." Like, yeah, a little backache is pretty standard, but severe abdominal pain, that's not. Or a little swelling in the ankles at the end of the day, okay. But swelling in your face or hands, that is a huge red flag we need to know about right away. Let me be super clear. Knowing these danger signs is absolutely non-negotiable. This is a patient safety issue, which means it is a classic NCLEX question. You will get a question that gives you a list of symptoms and asks which one needs immediate action. You have to memorize this list. No excuses. All right, time to put what we've learned to the test. Let's do a little practice question. You have a client. It's her very first visit, and she's 8 weeks pregnant. Take a look at these labs. Which ones are you expecting to be ordered right now? If you picked A, B, and C, you are absolutely correct. Why? Because the CBC, rubella titer, and blood type, those are all about getting that crucial baseline information right at the beginning in the first trimester. The MSAFP and the glucose test, those are important for sure, but they happen later in the second trimester, so doing them now would be way too early. Okay, here's another one, and this is a classic triage call you'll get all the time in your career. Your patient is in her third trimester. She calls you up and reports a new symptom. Out of these 4 options, which one is the true danger sign that needs immediate attention? And the answer is B, vaginal bleeding. The other things, heartburn, a little ankle swelling, feeling lightheaded, those are all pretty common discomforts we can manage with some patient teaching. But any vaginal bleeding at any time is a red flag. It has to be checked out right away to rule out really serious stuff like placenta previa or an abruption. So there you have it, the complete blueprint for prenatal care. But I want to leave you with one final thought, and it's probably the most important one. This whole workflow, it's not just a checklist of tasks. It's the framework you use to build a relationship. So the real question is, how are you going to use these steps, these questions, these teaching moments to build trust and really empower your patients? Because taking a clinical process and turning it into a real human connection, well, that is the art of nursing.